Today in NextGen Neurosurgery, we are going to talk about the cardiac disease and neurosurgery. People most of the time believe that when there's a cardiac issue, it's a bit dangerous to undergo neurosurgery. There's some truth in that. However, unless you are in the first few months after a cardiac event, there's no absolute contraindication to go for a neurosurgery. We need to understand that any cardiac disease that requires blood thinners, of course, has an effect to do a neurosurgery, because with the blood thinners, we can't operate on patients for nerve problems. Therefore, if you think that you have a cardiac problem, first thing that you should do is to tell that to the neurosurgeon. And the neurosurgeon will start a discussion with your cardiologist, and the cardiologist will give a recommendation about the condition of your heart. And if the condition is stable enough to go for the surgery, the anesthetist will further assess you to make you fit to go for the surgery. That will be done by a multidisciplinary approach where the anesthetist discusses with the cardiologist and the neurosurgeon to do the best possible treatment beforehand and make you fit for the surgery. And the surgery is always doing minimal invasive surgeries for a cardiac patient will be more helpful, because the tissue damage is less, the stress to the patient is less, the time period taken for the surgery is also less. Therefore, if you have a cardiac issue, please remember to tell it to the neurosurgeon and take the necessary steps with your cardiologist and the anesthetist to make you fit for the surgery. And then after surgery also have a good discussion and communication with the cardiologist and get the appropriate treatment until you recover completely from the neurosurgery. Then you can face any neurosurgery without any fear, and you will not get any serious complication after neurosurgery, even if you have a cardiac